Hi, everyone, and thank you for joining today's CounterTools Healthy Point of Sale webinar. Today's webinar is all about tobacco retail licensing, and we're going to hear from 3 different perspectives on this topic. Before we get started today, I want to do a little webinar housekeeping. Please write in the chat box if you can hear me and if you can also see the slide on your screen explaining the Zoom webinar orientation. Great, thank you. We'll go ahead and get started. So here at CounterTools, we provide training on why the retail environment matters for health, policy change, message framing, collecting quality data, and a lot more. We provide consulting on survey development and data collection, Synar sampling, data analysis, agenda setting, and policy identification. We also do storytelling, including the creation and sharing of data in a compelling way through reports, infographics, leave-behinds, and maps. We have tech tools for data collection and prevention and enforcement efforts, mapping, and retailer list management. We also support advocacy efforts. While we can't lobby, we do support evidence-based legislation and work with others on their advocacy initiatives. We also disseminate science and best practices through our training and technical assistance and speaking at conferences, and also through countertobacco.org, our podcast, and our Healthy Point of Sale webinar series, which you are all on today. And speaking of countertobacco.org, it is a helpful free online resource, and it's the first comprehensive resource for local, state, and federal organizations that are working to counteract tobacco product sales and marketing at the point of sale. The site offers evidence-based descriptions of the problem, policy solutions, advocacy materials, news updates, the latest research, youth engagement activities, and a media gallery exposing tobacco industry tactics at the point of sale. So please check out the site if you haven't already, and feel free to sign up for the monthly newsletter to get all of this information delivered to your inbox every month. Lastly, here is a snapshot of our past and present partners. We work across the country in states with local and national organizations like the Truth Initiative, Campaign for Tobacco-Free Kids, and many more. Now I'd like to introduce our first speaker for today, Dr. Barrington-Trimis. Dr. Barrington-Trimis is an epidemiologist and assistant professor of preventive medicine at the University of Southern California. She directs the USC Epidemiology of Substance Use Research Group and is a faculty member in the USC Health, Emotion, and Addiction Laboratory, the USC Institute for Addiction Science, the USC Tobacco Center of Regulatory Science, the USC Institute for Health Promotion and Disease Prevention Research, and the USC Norris Comprehensive Cancer Center. Dr. Barrington-Trimis' research focuses on investigation of the rapidly changing tobacco, alternative tobacco, and cannabis landscape. Her work aims to identify intra-individual psychological, behavioral, and social processes associated with nicotine and cannabis product use in adolescence and early adulthood, and to elucidate the behavioral consequences, such as transition to more harmful patterns of substance use, and psychological consequences, such as adverse respiratory health effects of cigarette use, of varying patterns of cannabis and nicotine product use in adolescence. So now I'm going to hand it over to Dr. Barrington-Trimis.
Okay, thank you so much for having me here. I am going to spend the next short while talking a bit about the retail environment and youth e-cigarette use in particular, and talking a little bit about how we can really think about tobacco control with regards to the retail environment in order to prevent youth from using e-cigarettes. So before we begin, I think it's useful to talk about what has been happening in terms of trends in youth e-cigarette use over the last decade or so. So these data are from the National Youth Tobacco Survey, which is a survey of high school students. And the percentages shown here are the proportion who reported using a product in the past 30 days. So back in 2011, when e-cigarettes were still relatively new in the market, the rate of e-cigarette use was quite low. Around 1.5% of youth had reported use of e-cigarettes in the past 30 days. This increased through 2015. There was a little bit of a dip here, but in 2018, the prevalence of past 30-day use of e-cigarettes was over 20%. And in 2019, it was around 27.5% of high school students reported using an e-cigarette in the past 30 days. At the same time, from 2011 to 2019, we saw a little bit of a decline in cigarette smoking primarily from 2011 down through 2014 or so. And after 2014, it sort of leveled off a bit through 2019, where the rate of cigarette smoking was about 5.8% in the past 30 days among high school students in the US. In this nationally representative sample. Overall, you know, the attempts to denormalize and denormalize cigarette smoking and overall tobacco control efforts have been quite successful in the state. More recently, the state has expanded to not only just initial heavy prevention of heavy cigarette smoking, but also a recent campaign to address social smoking, which is evidenced here in the lower left-hand corner. And then, of course, recent campaigns to address the youth e-cigarette epidemic, most notably the Still Blowing Smoke campaign and the Wake Up campaign, which are both run by California. So, with all of these successful tobacco control strategies, a lot of what is going on now with e-cigarettes and youth leads to, like, we need to continue to implement effective control strategies. And so through the course of this presentation, I'm going to talk a little bit about some of the research that we've looked at that is explicitly tying it is sort of highlighting the areas where we need tobacco control and maybe need better enforcement of tobacco control policies to impact the rates of youth e-cigarette use. So I'll address a couple of important questions. So first, of course, before we can implement effective tobacco control, we need information regarding where youth are getting their e-cigarettes. When they purchase their e-cigarettes, we need to know where they're buying them. How are youth able to purchase tobacco products when they're underage? A good question. And then, of course, what is the impact of strong tobacco control policy? And I'll talk about e-cigarettes specifically. Okay, so just a quick overview of the two studies that I'm going to be presenting data from. The first is the Happiness and Health Project. So this was a study of 3,400 teens that were recruited from 10 high schools in the Los Angeles area. We administered 8 semi-annual surveys from 9th to 12th grade, and we are currently doing annual surveys. Although we just got another grant, so we're switching back to doing semi-annual surveys again, which is great. We've collected a lot of data on sociocultural and demographic characteristics, mental health, health behavior, and effective response to exercise, substances, food, and a bunch of other things. We had really high retention for this study, about 99% per wave. The second study is the USC Children's Health Study. So this is also based in Los Angeles. The total for the Children's Health Study, or the CHS, we've recruited more than 12,000 youth over the last 25 years or so. There are 5 total cohorts that have been given annual surveys since the beginning of the study. The most recent cohort has about 2,000 kids that were recruited in 11th or 12th grade, and we have a pretty stable sample of about 1,500 youth and young adults who have completed annual surveys over the last 5 years or so. We also collect data on socio-demographic and sociocultural and different demographic characteristics on tobacco and alternative tobacco product use, and on a number of different health behaviors. Okay, so The next thing I'm going to present is some initial data that actually hasn't been published yet. We specifically wanted to know really what kids were using in terms of what specific types of products and where they were getting those products from. So we presented youth with a few different images of different products. So in the top left corner, we have your disposable e-cigarettes, vape pens in the middle top up here, box mods in the bottom left, a Juul, of course, in the top right here, and then different types of pod products in the bottom right. So we presented our participants with these images one at a time, followed by questions on what they call that product, whether they've used it, whether they have or how they got a hold of this product if they had used it, and if they had reported that they purchased that product, we asked them where specifically they purchased that product. So we didn't really see a lot of differences across the different products, but I did want to just present the complete data here. So we have Juul in the white bars, Pod Mod in the gray, then going to disposable e-cigarettes, box mods, and vape pens in the darkest black. So you can see the patterns are relatively consistent over time. This is just across the products. So this is data from the Happiness and Health study, and we just asked youth, where did you get your e-cigarette? So this is among kids who reported that they had used that type of product. Where did they get it? By far, the most popular way of getting that product was actually purchasing the product themselves, which is kind of interesting to me because all of these kids are under the age of at which they can legally purchase products. So in California, you have to be 21 to purchase products, and all of the youth in our sample at this wave are still under the age of 21. The next most popular place was where they got their products was either that someone gave it to them or somebody else purchased it for them. And of course, this smattering of kids who said that they found it, stole it, took it from family or some other method. So most underage youth are obtaining e-cigarettes by purchasing the products themselves, which I think is really critical information for us to have. And of course, a smaller but sizable proportion obtain products from others, either by purchase or gift. So the next question we wanted to ask then is, well, when they purchase e-cigarettes, where are they buying these products? Are they buying them from friends? Are they buying them online? Are they buying them in stores? And all of these, the answer to this question has a lot of implications for tobacco control. If youth are primarily purchasing products online, then I think our tobacco control strategy needs to be really focused on making that as inaccessible to youth as possible. On the other hand, if youth are primarily purchasing products from their friends at school, that necessitates a different type of tobacco control strategy. Or if youth are really primarily purchasing products from vape shops or from convenience stores or gas stations or whatever, from like brick and mortar retail stores, that again is really gives us some evidence regarding what type of tobacco control policies are going to be most effective at reducing youth use. So this is data, the first set of data I'll present is from the USC Children's Health Study. So in this study, we asked kids specifically where they got their e-cigarettes. And so they reported on the locations where they purchased their products. So about half of the students in this, or half of the young adults in this study said that they did not purchase. But among those who purchased their products, the vast majority reported that they purchased them from a vape shop. So this was far and above the most common location for purchasing products. Purchase from gas stations, convenience stores, or over the internet were really low in this study. And there are two bars here for pre and post tobacco 21 law. And you can see there's not really too much of a change across in terms of where youth and young adults are primarily getting their tobacco products. Going back to the happiness and health study, we asked them the same question. So if they reported that they had purchased their product in the last 30 days, we asked them from where did they purchase it. Most common, again, was that youth had purchased their e-cigarettes from a vape shop. And this was true for pretty much all of the types of products, with one exception, which is for vape pens. And the reason that this was so low is that the majority of participants who were using a vape pen were using a vape pen with THC. And in California, THC cannot be sold at vape shops where you have to go to a specific marijuana shop. So this is so in addition to vape shops for the majority of products, the other place that seemed quite common for youth was to purchase products from online brand retailers. So again, these have important implications for where our tobacco control efforts really should go. Definitely vape shops are coming up in multiple studies as a place where underage participants and underage youth are purchasing their products. But in this study, it also seems that online brand retailers are another place where youth are getting their products. Purchase from like eBay, Craigslist, Facebook, or other places online were relatively low, as were purchases from tobacco specialty shops, grocery stores, pharmacies, gas stations, and a little bit more of an increase for purchase from friends, particularly for vape pens and disposable e-cigarettes. Okay, so most underage youth are purchasing e-cigarettes at vape shops, but one of our studies also found that they may be purchasing online from brand websites. So I guess the next question then, how are youth able to purchase tobacco products when they're underage and shouldn't legally be able to do so? So we asked kids specifically in this study whether they had been refused purchase of e-cigarettes because of their age. So in this study, this is from the Children's Health Study, we had a sample of participants who were under the age of 21 and those who were 21 or older. So among those who were 21 or older, nobody said that they had been refused purchase of e-cigarettes because of their age, which is expected. They're all over age, so that shouldn't have happened. But among those who are under the age of 21, you can see that the vast majority of these participants, shown here in red, were not refused purchase of e-cigarettes because of their age. In fact, 86% of our participants who had tried to purchase products in the past 30 days reported that nobody had told them they couldn't buy products because of their age. Only 14% said somebody refused to sell products to them. So a similar finding from another study led by Dr. Abel Raisler was published recently in JAMA Pediatrics, where they specifically went into stores. They sent participants between the age of 18 and 20 into stores in all across Southern California to have them try to purchase cigarettes or vape products. They found that by and large, there were very high rates of vendors that failed to check identification and really high rates of underage tobacco sales. So, for example, this first half on the left-hand side here is failure to check identification. And you can see that fully 50% of vape shops refused or failed to check the identification of the youth that had gone into that store to purchase a vape product. Okay, this is really, really high rates of not checking ID at all. In terms of underage tobacco sales, this was also quite high. About 45% of youth who went into vape shops to purchase vape products were able to purchase those products and without having any identification on them, without having an ID, they were able to purchase these products. So in tobacco and vape shops, this is largely where the highest rates of violation are. So in vape shops, the highest rates of not checking ID and the highest rates of sales of tobacco products to those under the age 21 under the age of legal purchase. So again, underage youth who purchase e-cigarettes at vape shops are largely not being refused purchase, and the violation rates for sales to minors in vape shops are very, very high. This is really an important point when thinking about different tobacco control policies. So in California, and in Southern California in particular, there have been a lot of different policy proposals that have really focused on really trying to reduce access to tobacco products and trying to reduce youth initiation and use of tobacco products. One of the policies that has come up recently has been this prohibition of the sale of e-cigarettes in flavors. But one of the things that I've seen come up over and over again in different locations is exemptions for places like vape shops that are restricted to those who have to be 21 or older to enter the store. Now, from our study and from the other study done in the state of California, we found that most of the time youth are purchasing their products from vape shops, which are supposedly restricted to those who are 21 or older. And vape shops are also the places that had the highest violation rates. So in a city that is implementing a flavor ban across the board, but allowing an exemption for vape shops, this seems to me to be potentially not a good policy because of the fact that most kids are getting their products from vape shops. And so strong tobacco control policy is not going to allow for that exemption, when we're thinking about kids and how to protect our kids. Okay, so what is the impact of strong tobacco control policy? So this was from a paper that we wrote recently where we looked at the state of tobacco control grades that are published by the American Lung Association, and specifically wanted to see whether local jurisdictions that had better tobacco control may also have reduced use of e-cigarettes and other tobacco products. So the American Lung Association publishes the state of tobacco control grades. They have a number of different types of grades, so an overall grade, smoke-free outdoor air grade, a grade for smoke-free housing, and a grade for reducing the sales of tobacco products to minors. So with the reducing sales of tobacco products, states get a grade, local jurisdictions get a grade that's based on whether they have an adequate retail license fee to cover the cost of administration of an enforcement program and regular compliance checks, whether they require an annual review of the local license, whether there's a provision that any violation of local, state, or federal law is a violation of the license, and include a graduated penalty system for violators, including financial deterrents such as fines or other penalties, including license revocation or suspension. So states or local jurisdictions that have all four of these things receive a grade of an A, and if they have fewer of these, their grades go from A down to F. So in particular, the kind of the most important component that we have identified here is this adequate retail licensing fees to cover the cost of administration of enforcement program. So the idea behind this is that if local jurisdictions have a fee that allows them to send people into stores to do these sting operations or compliance checks, that this is going to really ultimately reduce the likelihood that these stores are selling to minors, especially if that's accompanied with any sort of penalty when that's not done. A lot of local jurisdictions have kind of been resistant to this recently, and when I've gone to different city council meetings, stating that, well, the federal government is doing these compliance checks, or the state government is doing these compliance checks. So why do we also need to do compliance checks? And I think a good answer to that is that the federal government and the state government just simply do not have the resources to go into stores on a frequent basis. So oftentimes, they're not going in every year. They're definitely not going in more than once a year to check at a given store. And there may be certain cities or certain stores that are just, it's 5 years in between the one compliance check that they do. So local retail licensing fees that cover that allow for just better tobacco control and allowing more frequent enforcements and compliance checks. Okay, so from the study, we found that both that youth living in jurisdictions that had strong enforcement were less likely to use both cigarettes and e-cigarettes. So you can see reduced odds ratios here, both for initiation and initiation with current use. For e-cigarettes in particular, there was about a 50% reduction in the risk of initiation and current e-cigarette use for youth who are living in jurisdictions that had strong tobacco control efforts in place. Okay, so tobacco control policies that really prioritize enforcement of restrictions of sales to minors can successfully reduce initiation of e-cigarette use among youth. So to conclude, most underage youth obtain e-cigarettes by purchasing these products themselves. When purchasing e-cigarettes, most purchases are from vape shops, with a smaller but appreciable number of purchases from online brand retailers. Youth are easily able to purchase e-cigarettes from vape shops where violation rates for sales to minors are very high, and youth are largely just not being refused purchase of tobacco products. Strong tobacco control policy can reduce youth initiation and use of e-cigarettes, and other local jurisdictions really should focus on beefing up their local tobacco control at the local level, in addition to, of course, continued efforts that are needed to continue to implement strong tobacco control policy at the state and federal level. And so with that, I just want to thank all of the collaborators that are involved in this research, especially Sam Swalina and Sarah Schiff, who are leading the two papers that really are looking at where kids are getting these products. So I will, I think I'm going to actually turn it over and we'll do questions at the very end.
Great. Thank you, Dr. Barrington-Trimis. That was wonderful information. Next, we're going to hear from Colleen Hughes. And Colleen Hughes is a certified substance abuse prevention consultant employed by the Virginia Department of Behavioral Health and Developmental Services as a behavioral health wellness consultant. Colleen has been working in the field of prevention for the last 12 years, coming from North Carolina, where she worked for Partnership for a Drug-Free North Carolina as a prevention program manager and Center for Prevention Resources consultant. Colleen has been involved with developing, implementing, and evaluating programs, practices, and strategies for youth, adults, and communities. As part of her role of Synar coordinator with the Virginia Office of Behavioral Health Wellness, Colleen has made the prevention of youth retail access to tobacco products a priority. She has renewed the state's merchant education initiative and has launched a statewide retailer verification project, which includes individual store audits that will help shape the retail environments of the communities across the Commonwealth of Virginia. So thanks so much for joining us, Colleen, today. I'm going to hand it over to you.
Thank you so much, and welcome everybody. I'm so glad that you could be here in attendance. Just a little bit of background. I am the Synar coordinator. For those of you who don't know what Synar is, it is a federal requirement that specifically addresses youth retail access to tobacco products. Virginia has expanded it to include all nicotine products. So that includes, vapes as well. We are one of 10 states that does not have a licensing program, which basically means I could go to a big box store, buy tobacco products at wholesale and sell them out of the trunk of my car, which has posed quite a problem for us while we tried to kind of get a handle of what our tobacco and nicotine landscape looks like. In 2014, our Senate or our General Assembly passed Senate Bill 96, which is what made it illegal for anyone under the age of 18 to purchase or possess vapor products. So my office was basically put in charge of getting a handle on vapor products. Without licensing, it became a problem. I don't know about your states, but I know in ours, our vape stores kind of pop up like mushrooms. And so they're here one week and then they're gone another, or they change names. And so really trying to keep track of it has been a challenge. So in 2015, next slide please, 2015 we contracted with, we have 40 community service boards across the state. So we contracted with them to verify the stores that we thought we knew about and to identify stores that we didn't know about across the state. So each of those community service boards were given $10,000 to conduct this verification project. And they did it by driving every primary and secondary road in their state, in their catchment area. So for the state of Virginia, it was just over 56,000 miles of road that they traveled and identified any retailer that had any sort of nicotine products. So that included these vapes, vape stores, hookah bars, as well as your general retailers like your big box stores, your grocery stores, your convenience stores. Next slide. So what did we get out of all of that? We got some grumbling, but for the most part, everybody really enjoyed this piece of it. So our initial list started with about 4,000 retailers. We included these other lists that we were aware of, the FDA list, a Dun & Bradstreet list that we had purchased, and that brought us to about 8,200 retailers. The verification piece, that ground truthing piece, removed about 30% of stores that were not tobacco retailers. Either they were somebody's residence or they were stores that were closed and had been closed so long that trees were growing through them. These were all stores that were on our list that had no business being on them. And then if the only thing that came out of this project was this next point, then I would have been happy. The ground truthing added about 2,000 stores to our list that were not on any of the other lists once we combined them. So it's 2,000 stores that would have never been subjected to any sort of inspection, 2,000 stores that had no reason to not sell to those 15-year-olds. So that was, for us, that was a major win. Had we had licensing, we wouldn't have had to do all of this. And so now how do we go about keeping this up to date? So again, we enlist the help of the community service boards, or these CSBs, and every 2 years they go out and conduct store assessments and provide merchant education to 100% of their retailers. The assessments allow for the list to be continuously updated every 2 years because new stores can be added, edits can be made to existing stores if they needed, like if a name changed. If they've closed, they can be pulled off. And so currently, as we speak right now, our total tobacco retailers, including vape stores, hookah bars, all of those, is 8,489. As I said, I'm the Synar coordinator, and we measure our retailer violation rate is how we're kind of evaluated on the Synar process. Unfortunately, our retailer violation rate has increased almost 60% over last year and is now at 16.8%. This is important because if that retailer violation rate goes above 20, then for the state of Virginia, it's about $17 million that come into jeopardy. Some of the reason for this is that we are, our accuracy rate in our list for that dropped, it was down to 80.5% in 2008. It has gone back up to just about 87.5% this year. but a retail licensing would really help shore that up and provide us with a really good comprehensive list of all of our tobacco retailers that are across the state. And then just to point out, if you're interested in what the American Lung Association tobacco control grade is for Virginia, we are straight Fs across the board. We have lots of work to do. We did pass a Tobacco 21 law this past General Assembly. I think Chelsi might touch on that a little bit more as to how we can improve it. But you know, licensing fees would help cover that enforcement, which would help reduce the retailer violation rate, would help reduce access for our youth to these products. As it stands right now, our enforcement is very minimal. I know that the gold standard is that every retailer gets 2 inspections or 2 enforcement visits each year. Currently, as it stands, Virginia is only inspecting 8% of their retailers, and that's solely on what stores are being inspected under Synar. We have not had an FDA contract in our state since May of 2018, so we've lost about 42% of our inspections combined. With FDA and Synar, we were looking at about 50% of stores being inspected annually. But since May of 2018, those FDA portions have not been happening. And so I think that's a direct correlation as to why we've seen such an increase in our retailer violation rates. Is because I know, and we all knew that this was going to happen, it doesn't take long for the retailers to realize that inspections and enforcement visits are not happening at the same frequency. And so I really do believe that, you know, increased enforcement would have kind of resolved some of this increase. But again, it all comes down to money. We do not receive state money for any tobacco enforcement or any additional prevention work that we do in Virginia. It all comes from our federal block grant. So if we could incorporate licensing and have those fees go directly to enforcement, I think that would do a big, that would help out immensely with that retailer violation rate and the access that our youth are getting to our tobacco products. Next slide. Here's my contact information. I'm happy to talk more about this project. Like I said, it started in 2015. It is nonstop. We continue it on every 2-year cycle. And I know that Chelsi's going to share with you what our hopes are moving forward this next General Assembly.
Thank you so much, Colleen. I know we'll have questions for all of the presenters that we will have time hopefully to address at the end here. So next we're going to hear from Chelsi Bennett. Chelsi Bennett, JD, currently serves as the Virginia Government Relations Director for the American Heart Association. Chelsi has a wealth of experience from both serving as a staff person for an elected official and having served as an elected official herself. Ms. Bennett began her career working for a global company with offices in over 70 countries. During her tenure, she managed diversity committees globally and planned and executed events in India, Israel, North America, and the United Kingdom. Mrs. Bennett was elected in 2010 as the Commissioner and Supervisor of Soil and Water Conservation, District Group 5 in Jacksonville, Florida. She served for 3 years and was the youngest elected female in Jacksonville's history. After serving as an elected official, Mrs. Bennett was appointed by a Florida cabinet member to serve as a senior policy advisor in Florida's capital. All right, thanks so much, Chelsi. I'll let you take it away.
Well, awesome. Good afternoon, everyone. Again, I am Chelsi Bennett, and I am excited to be here today with each of you who are on the call. So over the past 40 minutes or so, we have had the opportunity to really kind of dive into tobacco retail licensing from a policy perspective, a research perspective, and then you just heard from my colleague Colleen about what's actually happening or not happening here in Virginia. In my role with the Heart Association, I'm responsible for both state and local policy. And I started in this role about 6 months ago. And so thanks to so many of you, you all have helped bring me up to speed in this policy area. Yet I want to spend some time today sharing with you our approach, our goal for the 2020 legislative session in regards to tobacco retail licensing. You can go to my slide, please. So as you just heard from Colleen, there is no retail licensing structure or system here in the state of Virginia. And as we heard earlier in the presentation, 86% of those under the age of 21 are able to buy tobacco products in vape shops from that research. And that is just a telling number, but also a real-time number to show the importance of why there needs to be not only tobacco retail licensing, but strong tobacco retail licensing. Something that Colleen alluded to was Tobacco 21. You may have heard that last year, Tobacco 21 passed here in Virginia, yet from the Heart Association's perspective, it was a very weak bill, as there is still a military exemption. Purchase use possession laws are still in there. We didn't address education, enforcement, or retailer fines, which currently here in the state of Virginia, they increase at a higher rate than that for the youth. And so Virginia, we are at this critical juncture when we talk about tobacco, where it's time for us to be able to put in that legislation that's truly going to be the infrastructure that's needed. Because you can have one, semi-good law, yet if the infrastructure is not there for enforcement, it causes an issue. And so that's where we are now. Again, as my colleague Colleen was sharing, there has not been enforcement from the FDA. Our contract ended May 2018, and there has not been state enforcement here since we passed T21 July 1st. And so there needs to be this infrastructure, not only for us to be able to identify tobacco retailers, but also, as you can see here on this slide, there's so many benefits of a strong tobacco retail licensing structure and legislation. And so that's going to cover education and training. That speaks for itself to allow for there to be merchant education. Here in Virginia, we also still have this loophole where when a retailer, if they were, found to be in violation of selling to an underage kid, when they go to court, there's currently still in our laws discretion for the judge to throw out their case if that retailer comes in and says, hey, I educated my clerk, but there are no loopholes for our teens. And so one of the things is that as we are looking at tobacco retail licensing, as well as strengthening our Tobacco 21 policy, which we see goes hand in hand. Some of you may be familiar with the Tobacco 21 model policy, American Heart Association, Campaign for Tobacco-Free Kids, Public Health Law Center, American Lung Association. So many of our partners, we worked on this, and the latest edition was released in April of this year, but it talks and goes into some more detail about the importance of tobacco retail licensing. With infrastructure, again, as you see under the benefits of tobacco retail licensing, it's those unannounced compliance check. It's the administrative costs that we would be able to gain through licensing fees and violation fees. And so here in Virginia, the approach that we've taken as the American Heart Association, as well as being a member of the Tobacco Free Alliance of Virginia, where I also serve as the policy committee chair, is we have been chatting with and meeting with the administration here in Virginia. And so we've had meetings. I've sat down with the commissioner of the Virginia Department of Health, 2 of the deputy secretaries, and our goal has been to be proactive this year. We've come to the table with a very robust tobacco policy agenda, which includes Tobacco 21, tobacco retail licensing, and updated to one of our tax statute definitions, as well as a tobacco and nicotine tax. And we've been taking this approach because in the past, you know what Virginia is. It's, you know, it's a tobacco state. And so for us, we know that, at least I can say for myself, in many instances, I may be the David versus the Goliath of the industry. You may also know that Altria is based here in Richmond, and I'm in the Richmond area. And so there's a lot of different politics that goes into that in terms of how we lobby, how we advocate, and even how we educate both legislators and administrators. And so we are being proactive. We've sat down, we've put together a robust policy agenda, because what we do know, and we all share, and I know you all share the same sentiment because you're on this call today, is that we must protect our youth and their families from addiction to tobacco and nicotine use. And so that is where we are. So I've given you a little background, shared the importance of a tobacco retail licensing system, and our approach here in Virginia in terms of how we are moving forward with what our strategy is. Again, we are being very bold. Some folks would say aggressive, yet our hopes is that at the end of the 2020 session, we will see positive momentum and hopefully the passage of at least one of our agenda items. Tobacco retail licensing would be a perfect item for us to see successfully pass through the legislature next year, just because, again, it is the infrastructure for us to be able to implement and protect our law, protect our youth. And so I am, from my end, I am just so honored to be a part of today's conversation, to share with you our Virginia strategy. I would love to be able to join in a year from now to share which parts of our strategy were successful, even from a campaign planning perspective, which is really big in any lobbying effort, because as you may know, the legislature, they are humans with their plans and priorities, yet we have a role, at least I do as a lobbyist, to implement and execute a strong campaign planning policy. So my hope is that at least from a year from now, I can share with you some of the pros and cons of the campaign planning strategy that we implemented this year, but we hope to have some wins. We're in it to win it because, again, we are all about our youth. Here in Virginia, the last time I looked at our Virginia Department Health site, you know, we've had 6 cases of illnesses related to e-cigarettes, you know, as we're monitoring the issue across the state. And so with all that, I could continue talking for probably days because I'm so passionate about this, but I will stop there and just open the floor for questions and hand it back over to you. But I hope that information was helpful in terms of what we're doing here in Virginia.
Great. Thank you so much, Chelsi, and thanks to all 3 of our excellent presenters that we had today on the webinar. We still have almost 10 full minutes for questions, so please feel free to type in your questions either in the Q&A box or in the chat box. We're monitoring both of those. And the first question that we have here, I believe this should be directed toward Colleen. Terry has this question: what is the total cost for the coverage study, and how do you update the list between studies?
So the retailer verification project, I mentioned that each of the CSBs were given $10,000 to go out and do their ground truthing, that driving every primary and secondary road. So it was we've got 40 of them, so it's about $400,000 to do the initial one. Moving forward, each year, each of those community service boards receive $10,000 to go towards Synar activities, so that they go out and they provide merchant education. They're also doing store assessments so that we have a really comprehensive picture of what our retailer landscape looks like. So each year we're investing $400,000. We keep that list up. So every 2 years, those community service boards have to go out and do the merchant education and the store assessment with 100% of the retailers in their catchment area. 2 years was chosen. It seems kind of like a long time, but I have Fairfax Falls Church, which is right just south of DC, and they have over 600 stores just in their small little area. So I had to pick a time frame that was going to be reasonable for them, because this isn't their only job. They've got other responsibilities outside of just doing this counter tools project. So every 2 years it's refreshed. Again, it's probably not the most ideal, but I had to take in consideration the number of stores that some of these community service boards have. So licensing would really, if we did an annual licensing fee, that would really help me out, would help the community service boards out, making sure that that list is up to date more frequently.
Great. Thank you so much, Colleen. We also have a question here from Jeff that was already initially, we had some response, but I'm going to throw it out there in case Dr. Barrington-Trimis wants to add to this. The question was there a correlation between e-cigarette policy regarding public use and reduced youth e-cigarette rates? Dr. Barrington-Trimis, I'll let you respond to that for the entire group and elaborate if you'd like to.
Yeah, sure. So, so this is a really good question, and I think if I understand the question correctly, there are different policies that are being passed. There's a few down here in Los Angeles that explicitly prohibit the use of tobacco products in public spaces, and so I think the question is whether those policies are also effective at reducing youth e-cigarette and cigarette use, which I think makes a lot of sense because of the strategy to sort of denormalize. So the less of these products there are around and the less that kids are actually seeing people use vaping products, the less likely they are to actually engage in these behaviors. And so I think this is a really good question, and we haven't looked at this explicitly, but I think it's worth looking into for sure.
Thank you. We're still monitoring for questions as they come in, so feel free to enter your questions in the chat box. I'll throw out one that I think is relevant to all three of our presenters today. We know from the research and from the on-the-ground activities that have been happening that strong enforcement does result in lower use of both cigarette and e-cigarette use for youth, which is a really wonderful thing to build upon. And we've heard from all three presenters in their own perspective the importance of adequate fees in order to reduce the sale of tobacco products to youth. So I'm going to throw out to all three presenters, if anyone wants to take this, based on your experience, what can all of us do at the local level to build the path forward to tobacco retail licensing?
Well, this is Chelsi. I can jump in from an advocacy perspective. As I shared, I am responsible for both state and local policy, and I know that you all are from all across the country, and so there's different laws, etc. Here in the Commonwealth of Virginia, we are a dealing rules state, and so that can be prohibitive sometimes in the things that we do. But what I have learned is that where there is authority for a local government to enact policies or even some type of resolution from your local council advocating for that can be important, because on the state level, again, in some localities, depending on the issue I'm working on, they may not have the authority to enact a law, but to have the support and the groundswell from the local communities, having advocates who are educated so that when your General Assembly is in session, you can be a strong, educated voice there. That is always, always helpful. And then the other point I would make that kind of ties into that is being able to speak on the issue in front of lawmakers. Get with one of the organizations that are here, or even internally with your own organization, and have some talking points about this so that you're able to speak on this, because I can share from the Heart Association's perspective, and I say it all the time, a big part of my lobbying muscle is my advocates. And not only just having advocates, but having advocates that are strong and educated and passionate about it, and being able to have those conversations with lawmakers, because as an advocate, you bring a perspective that me as a lobbyist it doesn't translate the same to a lawmaker when they have a constituent in front of them. And so I would just share those are, again, two ways that you can get involved. One being an advocate yourself, as well as on the local level, working with your local councils. Again, if they don't have the authority, they can still put in what we call here, at least in Virginia, a resolution, which is a voice of counsel, and it would help the other organizations in your state that are doing tobacco policy.
Yeah, this is Colleen. To piggyback off of what Chelsi said, all of our community service boards have community coalitions that they work with. And truthfully, a lot of the work that we do across the state of Virginia is done through the work of the coalitions, which are made up of community partners, whether it's the schools or law enforcement, health departments. It's those community members that really can get things done, because our prevention force is, in some parts of the area, it's really only one person. And so that we have to rely on our community partnerships. Getting involved in those coalitions that are addressing this, with so much vaping in the news, I think now is the time to kind of see what forward movement we can get on the topic. I know that there are some localities that do their own local law, use local law enforcement to do additional enforcement activities. If we could see more of that across the state, that would help immensely. I know that, they're just the visibility of retailers knowing that other people are watching. So having conversations with your retailers about the importance of not selling to the youth, and following the law, that alone, whether you have a law enforcement person with you or it's just you having a conversation, I think that goes a long way as well. And it really just raises the visibility that people are watching and people do care that you're selling to this, 15, 16, 18-year-old at this point in Virginia. And so just being more visible and really speaking to those that can make a difference, like Chelsi said, talking with your local legislators. I really think, now is the time to jump on it because it is so much in the news. I think it's on everybody's radar, and so to voice your opinions and to make it an issue, I think really will see some positive results. On a state side, with the increase of our retailer verification rate coming dangerously close to that 20% threshold, we're having conversations with our leadership, our state leadership, to see what can be done, because there is a substantial amount of money that's attached to this. And so we would be wise to, invest $1 million in order to not lose 17. And so we're beginning conversations with some of that senior leadership to see if we can't get some movement on a statewide level, so that we can kind of head this off before it puts us in violation of that Synar rule.
Thank you so much, Colleen. And to wrap us up here, I want to thank each of our presenters today for sharing your time and expertise and advice with all of us. There's a comment from Will that sums it up really well. He said, "I just want to share what a pleasure it was to hear from these three presenters today. It was a tremendous pleasure to have Dr. Barrington-Trimis, Colleen, and Chelsi share their expertise with us today." So the recording and slides from this webinar will be available at countertobacco.org. And lastly, I want to thank everyone who participated in today's webinar. Thanks so much, all.